It is welcome news. It is also very big news. Nationwide, there have already been 70 million vaccines administered, but it has been a hassle for this process to go through. And now, with the emergency authorization of the Johnson & Johnson vaccine, it is expected to boost supply immediately, and we could start seeing shipments go out nationwide as early as next week. On Saturday, the Food and Drug Administration authorized Johnson & Johnson's vaccine for emergency use.
One should have no qualms about taking this vaccine.
Dr. Larry Corey from Fred Hutch says this new vaccine, which only requires one dose and no unique refrigeration, should be available widespread by end of March. This vaccine is roughly 70% effective at preventing serious illnesses. Is it not important to get kind of hung up on those percentages about these different vaccines?
It really isn't right to get hung up on the percentages, because what's great about this vaccine is two things. Number one is prevent severe disease, 100% against death, 85 to 90% against hospitalization.
He says this new vaccine is also the first to be tested against new variants.
We really have broad protection coverage here.
He says it's more important to get a vaccine, not which vaccine you get.
If I'm going to give you a main message here, it is take the vaccine that's available to you.
He adds he knows it can be tempting to lax on being safe as more vaccines arrive, but stresses the importance of being vigilant as new variants of the virus pop up.
The virus has incredible infectivity and it has incredible staying power. The best way to not only protect yourself, but to prevent new variants from happening is to get vaccinated.
Now, he also stresses that, as you heard him just say, that we are still very much in a pandemic. So yes, the basics are still important. Washing your hands, wearing a mask, and being socially distanced. For now, here live in Seattle, I'm Tony Black, King 5 News.
Tony, thank you. Well, more than 1.5 million doses of COVID vaccines have already been distributed here in Washington state. So here's a look at the number of people who've received at least one dose of the vaccine in some counties. Now, looking at percentages, more than 15% of people in Skagit County have received at least one dose. And King County has given at least one dose to more than 13% of its population. Now, we don't have every county listed here, so if you'd like to look at a full map, just text the word data to 206-448-4545 and we'll send you a link. While the focus has been on the COVID vaccine, it turns out children are not getting other vaccines needed to prevent illnesses like meningitis and the chickenpox. The state health department found childhood vaccinations actually dropped nearly 20% last year. Dr. Jasmine Zavala says it is a combination of things here. So parents have been concerned about bringing kids in for a checkup during the pandemic. And because of remote learning, parents aren't reminded to update vaccination records, leaving some to fall behind.
These vaccines are required for school and sports participation. And so while schools are trying to figure out how to make a safe environment for readiness for everybody to return, it's a great time for families and patients to come back into the clinic to get ready and make sure that their vaccinations are up to date.
Medical professionals say if you feel uncomfortable taking your child into a doctor's office right now, call ahead of time and ask what measures are being taken to prevent the spread of COVID-19.